1. Which of the following medications is most appropriate for first-line treatment of hypertension in a patient with diabetes? A. Amlodipine. B. Hydrochlorothiazide. C. Lisinopril. D. Metoprolol. 2. What is the mechanism of action of omeprazole? A. H2 receptor antagonist. B. Proton pump inhibitor. C. Antacid. D. Prostaglandin analog. 3. Which antibiotic is contraindicated in children due to risk of teeth discoloration? A. Azithromycin. B. Tetracycline. C. Amoxicillin. D. Clindamycin. 4. Which medication is used as an antidote for acetaminophen overdose? A. Naloxone. B. Flumazenil. C. N-acetylcysteine. D. Atropine. 5. Which insulin has the longest duration of action? A. Insulin Lispro. B. Insulin Aspart. C. Insulin Glargine. D. Insulin Regular. 6. A patient on warfarin has an INR of 5.2 with no signs of bleeding. What is the most appropriate action? A. Continue current dose. B. Administer vitamin K IM. C. Hold warfarin and monitor INR. D. Increase warfarin dose. 7. Which of the following drugs can increase the risk of serotonin syndrome when combined with SSRIs? A. Hydrochlorothiazide. B. Tramadol. C. Ibuprofen. D. Atorvastatin. 8. What is the most appropriate treatment for H. pylori infection? A. Metronidazole alone. B. PPI plus amoxicillin plus clarithromycin. C. Antacids plus sucralfate. D. Bismuth plus H2 blocker. 9. What side effect is most associated with amiodarone? A. Hyperkalemia. B. Pulmonary fibrosis. C. Hypotension. D. Constipation. 10. Which medication is best avoided in pregnancy due to risk of neural tube defects? A. Folic acid. B. Iron sulfate. C. Valproic acid. D. Labetalol. 11. A patient requests advice about NSAID use and has a history of peptic ulcer disease. What should the pharmacist recommend? A. Continue NSAID with food. B. Avoid NSAIDs, consider acetaminophen. C. Use naproxen with aspirin. D. Take with milk. 12. A 75-year-old patient is prescribed digoxin. Which lab value should be monitored closely? A. Hemoglobin. B. Sodium. C. Potassium. D. Glucose. 13. Which drug is most likely to cause hypoglycemia in a patient with type 2 diabetes? A. Metformin. B. Sitagliptin. C. Glyburide. D. Acarbose. 14. What is the most appropriate counseling point for a patient starting bisphosphonates? A. Take with a meal. B. Take at bedtime. C. Take with full glass of water and remain upright. D. Crush and mix with applesauce. 15. A pharmacist detects a drug interaction between warfarin and an antibiotic. What is the best course of action? A. Do nothing. B. Notify the prescriber immediately. C. Dispense with warning. D. Advise the patient to stop warfarin. 16. Which of the following activities is within the legal scope of a Canadian pharmacist? A. Prescribing narcotics. B. Diagnosing medical conditions. C. Administering vaccines. D. Performing surgery. 17. What is the role of the PEBC in pharmacist regulation? A. Licensure issuing. B. Legal enforcement. C. Competency assessment. D. Insurance billing. 18. A pharmacist receives a prescription with unclear dosing instructions. What is the correct action? A. Fill the prescription as is. B. Estimate based on prior prescriptions. C. Contact the prescriber for clarification. D. Ask the patient to guess. 19. Which of the following must be recorded in the patient profile? A. Favorite pharmacy staff. B. Medical conditions and allergies. C. Grocery purchases. D. Marital status. 20. What must a pharmacist do when witnessing unethical behavior by a colleague? A. Ignore it. B. Report it to regulatory authority. C. Post it online. D. Discuss it with patients. 21. Which reference would be best for checking pregnancy safety of a medication? A. CPS. B. Micromedex. C. Motherisk or LactMed. D. Medline. 22. What type of study provides the highest level of clinical evidence? A. Case series. B. Randomized controlled trial. C. Cross-sectional study. D. Case control study. 23. Which statistical value reflects the likelihood that an outcome occurred by chance? A. Confidence interval. B. P-value. C. Relative risk. D. Number needed to treat. 24. What does NNT equals 5 mean? A. 5% of patients benefited. B. 5 people must be treated to benefit 1. C. 1 in 5 patients will have a side effect. D. 5 doses per day required. 25. Which of the following is a limitation of meta-analyses? A. Cannot include RCTs. B. Often biased by subjective review. C. Limited sample size. D. Heterogeneity between studies. Pharmacy Examining Board of Canada. The Pharmacy Examining Board of Canada PEBC test is a standardized national certification exam required for pharmacists and pharmacy technicians seeking licensure in Canada. It assesses candidates' knowledge, clinical decision-making, and practical skills to ensure they meet the standards of practice necessary for safe and effective pharmacy care. The exam typically includes both a qualifying examination written and OSCE components and an evaluating examination for internationally educated applicants. PEBC evaluates core areas such as pharmacology, therapeutics, patient care, pharmaceutical calculations, ethics, and legal regulations. Passing the PEBC exam is a critical step toward becoming a licensed pharmacist or technician, ensuring public safety and professional competency across Canada. Here are the top 5 beneficial uses of the sample exam. 1. Licensure requirement. The PEBC exam is mandatory for pharmacy graduates and internationally educated pharmacists to obtain licensure across Canadian provinces, ensuring they meet national practice standards. 2. Standardized competency evaluation. It offers a consistent, evidence-based method to assess candidates' knowledge, clinical judgment, and practical skills, supporting safe and effective pharmacy practice. 3. Quality assurance. The exam upholds the integrity and professionalism of Canadian pharmacy practice by certifying only those who demonstrate readiness for patient care responsibilities. 4. Supports workforce mobility. With a nationally recognized credential, pharmacists can more easily move and work across different provinces and territories in Canada. 5. Enhances public confidence. Certification through PEBC reassures the public that licensed pharmacists are qualified to deliver safe, ethical, and evidence-based care.